Yes, no, I don't know what the colours are, did you know that?
Okay, so folks, if we could have a look. I'm not expecting you to read that on the screen, but I'm talking about the kind of stuff we have done. So if we look over what you've done, you did a lot of work. Dr. Anderson and I and Mr. Chambers, obviously we divided up who was making videos and setting work and so on. And so that's why Dr. Anderson was doing the first topic with you. And then I've been sort of looking at what you've been doing on this recent topic of the heart. So she will sort of go over and revise the surface area to volume ratio and the respiratory system, breathing, structure of the alveoli and so on with you. I will look over this topic. Now this topic is obviously shorter, but the whole point of that, I want you to look at summer 2021 assignment. How are we doing? There's 6 of you haven't ticked that you've done this.
What is it?
It's just reading about what's going to happen in terms of assessment.
I don't think I've read that.
Yeah, so look, you need to go and read it. Folks, could we stop the chatting here? I know it's been ages since you've been sitting near your friends and chatting to them. But look, if you could just give me some time here. Look, initially we'd said when you're coming back after school after January, you're going to do a mock exam. And for a long time that looked likely that you would do that after you came back to school. But as SEA gradually started to release information about how the grading process is going to work, it became clear that that wasn't going to be essential. And we thought it would be easier for you and more manageable if rather than saying, right, you're going to sit in the hall and do a 1.5 hour paper and everything you've done. If we were able to break it up into smaller units and help you focus on smaller areas and do it the same kind of questions, but you know, in smaller chunks, okay? So you are going to be sitting 2 assessments after Easter. Now these 2 assessments will be like, SEA is going to release some assessment materials to school in the next few weeks. Now not this week, but sometime over the Easter holidays. And we're going to be using parts of those for these assessments that you're going to be doing. So it is exam style questions, similar to the kind of past paper questions you've done. But your grade is not going to be based just solely on these 2 assessments that you do after Easter. Okay, because we can use marks that we've got throughout the year. So things like class tests and so on can count towards that final grading. Okay, so the tests are important, but they are not the only thing that will count. So don't panic about that. It should be more manageable than doing 1 mock exam. All right?
Will I be like right after Easter or a couple of weeks after Easter?
We will try to sit down and tell you before you get off. Hopefully we'll tell you, like it'll not be the first day or the second day or anything. Okay? And they will be spread out as well. Because we want to give you the best chance to prove what you can do. All right, so you're not going to be hit with them on the Monday or the Tuesday.
Is there only going to be 2 of them?
Yeah, only 2.
Well, the topics we don't over lockdown, do it?
Pardon?
Well, the topics we don't over lockdown, do it? Like the...
Yeah, So, but hopefully at the moment, you know, we've said there what the topics are going to be, but hopefully we'll be able to narrow that down for you to make it more manageable. All right. So you need to read through that assignment. Okay. So I've been looking at the heart. I'm aware, I mean, the last few months have been difficult. For example, you know, there's lots of things can happen that can just throw you off your way of working. So if your Wi-Fi goes down, or maybe if you want to print something out, you can't print it out, and some people find it harder then to study. So, and probably family situations and so on, they've been different from everybody, different for everybody. So everybody's had different things to contend with. It hasn't been easy, but certainly I've been very happy with the majority of the work I'm getting in. And for most people, we're getting it in on time and it was well done. So you need to keep that up. There's a few of you who've got a few things still to hand in, so if you could get on with that. Because it's important that you know this stuff and understand it and can answer questions on it. So, I suppose what we can do is, I was asking, you were looking at some past paper questions on the heart, so if you could get those out. Look, if you need hard copies of any notes or any questions, if you could let me know today, I will try to get them run off then for Wednesday so that you've got everything in front of you. So, I suppose if we look at this unit here, how many people need copies of...
I've done the wrong pages in this book for this, because mine
You-
says page 14 there.
Right, okay.
Can you put me up past paper quiz?
So,
Please.
Anna, you are
Okay.
the next.
So I can tell you, what you need to do, what you need to do is send me an email before the end of school tomorrow, all right? With a list. Shh. If you just go through this classroom and if you say, right, okay, just on this topic, if you haven't been able to print anything out, okay, just say, look, I need lesson 1, I need a copy of... Right, this isn't loading up here. But if you need a copy of the summary, if you just give me a list of whatever you need a copy of, all right? All right? And so if you make sure you get that into me before the end of school tomorrow, and then hopefully I'll have it for you on Wednesday then when you come in. Okay, so if you need hard copies of anything in this topic, just let me know. Let's have a look at some of these past paper questions then. So, 24 to 30. So, if many people have these with them. Okay, right, so if you've got them, if you haven't got them, piece of file paper, you can jot down the answers and then you can mark it against your own or try it. If you haven't already tried it, try it and then mark it later on. So what's the word here? The ability of cardiac muscle to contract without stimulation. Myogenic. What are the specialised muscle fibres which convey an impulse down the septum from the atrioventricular node? So if this is your heart, you've got the sinoatrial node. Impulses go across the atria. What do we call things down here that go down the septum? Bundle of His. What are the structures which prevent the atrioventricular valves, so these valves here, from turning inside out? Chordae tendineae. Okay, the valves which close when the arterial pressure exceeds the ventricular pressure. So the arterial, well, we've got the two vessels coming up here and here. And we've got little valves in the openings to those. What kind of valves are they? Good. And the arteries which carry oxygenated blood to the heart muscle itself. I don't think this was covered in your notes so far, but you should remember this from year 12. Coronary, yeah. Okay, next page. Which area of tissue initiates the heartbeat? Sinoatrial node. How is atrial systole brought about? Well, you need to say that impulses from the sinoatrial node, travel across both atria. And that causes the atria to contract. What is the role of the non-conducting tissue found between the atria and the ventricles? So going back here, we've said sinoatrial node, impulses go across there. The non-conducting tissue, what does it do? So it prevents the impulse reaching the ventricles. In other words, it prevents what happening to the ventricles? Contraction. Okay, so basically it stops the impulses from reaching the ventricles, therefore the ventricles do not contract. Or if you said there's a delay before the ventricles contract. So what's the consequence of that? Why do we need that delay? Jamie, what do you think?
Here's the blood emptied out.
Yeah, so that the blood can enter the ventricles. If the ventricles were contracting, the blood wouldn't be able to go through the atrioventricular valves. And so the ventricles are still relaxed for a period, just a part of a second, to allow the blood to enter the ventricles from the atria. Shh. Okay, so we talked about the bundle of His, which takes the impulses down here, and then we've got the Purkinje fibres that carry the impulses up from the base of the heart. Why is it important that that's the way it happens? Ellie Stinson, what do you think?
To ensure blood is pushed up from the ventricle into the arteries and the ventricles empty.
Yeah, so you need to say so that the contraction starts at the base of the heart. Okay, there's 2 marks for this. So you talk about, first of all, the contraction starting at the base of the heart. And then what Ellie said there about so that all of the blood can get pushed up out of the ventricles and into the arteries. So that should be contraction, or it contracts starting at the base. Okay. So, same information here, just a different kind of question. So, explain or describe how the wave of excitation spreads through the heart during a cardiac cycle. So, you need to say it's initiated here, and the impulse is spread across both atria. I would say they're prevented from spreading to the ventricles because there's a layer of non-conducting tissue. Okay, then the atrioventricular node sends the impulse down the bundle of His and up to the walls of the ventricles through the Purkinje fibres. You don't need to talk about the contraction in the blood because it just simply asks how the wave of excitation, so that is basically the impulse. I suppose we've already mentioned this. Why can the wave of excitation not go directly to the ventricles? Well, we've said there's a layer of non-conducting tissue, separating the atria and the ventricles, or preventing that. Okay, part C over the page. Why is there a delay? And this is the same question that we answered 2 pages ago. It's to allow blood, blood to enter the ventricles before they start contracting. Why is it initiated from the bottom of the chambers? So that contraction, the wave of contraction starts at the base of the heart, pushing all the blood out of the ventricles up into the arteries. Okay, part D here. What's the role of these valves? Valves, we tend to talk about them closing to prevent backflow of blood. But they also, you need to mention about them opening. So you would say atrioventricular valves open to allow the blood to flow from the atria to the ventricles. When ventricular contraction occurs, they close to prevent backflow of blood back into the atria. The semilunar valves open when the blood pressure in the ventricles increases, forcing blood into the arteries. But whenever the arterial pressure is higher, they close to prevent the blood flowing backwards into the ventricles. So you need to think about open and closed, what they allow and what they prevent. And make sure you mention atria into ventricles, prevent backflow back into the atria, and then ventricles into the arteries, and talk about then them closing there. Look, I think we'll stop chatting there. Put up your hand if you need a copy of those questions. Right, I will get... Do you have Dr. Anderson tomorrow? Yeah. What I'll do is I'll get them printed out, give them to her to give out to you tomorrow. Okay? And then you can be working on them, all right?